Welcome back to Showcase Pittsburgh on KDKA TV. I'm John Klein. Today, 7 businesses. Scott Waitlevich from Equitable Gas, Andy Kem from Yamato Hibachi and Sushi Bar, Ed Meyer from Tri-State Office, and Dr. Nathan Lockery from Aspen Dental. But right now, Bill Weil from Life Pittsburgh. Welcome back to Showcase Pittsburgh, Bill.
Thank you. Thanks for having me.
Every time you guys are on, we just talked about this, we change lives somehow.
We do.
So let's go back and start at the beginning in case there's somebody tuning in this morning who's never seen you and has never heard of Life Pittsburgh. What is it that you do?
Well, Life Pittsburgh stands for Living Independence for the Elderly. And so what we're all about is providing all the medical care, home care, prescriptions, including transportation and adult day health centers for seniors to be able to reside safely in the home.
And when you say seniors, are there specific age limitations?
Well, there is actually. It's the age is between 55 and I think we have someone who's 101 years old.
Okay.
So it's that range. But you have to be 55 to get in the program. You must reside in Allegheny County.
So there are a lot of different things that Life Pittsburgh does, and it organizes all of these things to try to make life a little bit easier for some seniors.
Yes, it does. You can imagine if the challenge that it is for seniors with typically multiple medical conditions to manage all of their medical conditions, to remember to take their medicines, and to have some sort of socialization, to get the physical therapy they need. Maybe they need occupational therapy. And moreover, we support them with recreation therapy, getting them to all their specialists that they need, and we have specialists on site at our adult day health centers. So a very preventative program taking care of people who really need help to stay in the home. And maybe they have caregivers, but maybe the caregivers are getting a little burnt out.
We talked about this before we got started. You said the average caregiver lasts about how long before they get burned out?
I've heard 1 year.
That's it?
That's it. I mean, imagine you're managing your own family. Maybe you've got kids, maybe you don't. Maybe you've got a full-time job, and you've got someone who either lives with you or lives in their own apartment who you've got to take care of. They have social needs, they need interaction, they have to remember their medications, they may be tripping and falling in the home. So
there's a lot to remember. Right. And it's as somebody gets older and maybe slows down a little, it seems like their schedule gets busier and they have more things to maintain throughout the day, whether it is medication or doctor's appointments, or you mentioned the social aspect. You have social centers.
Yeah,
where,
we have.
Where
It's called Adult Day Health Center. So let me give you a sense of what a typical day would look like. We would pick you up in your home. Okay, so we have vans and we arrange all the transportation. By the way, everything for most of our participants is all free, no co-pays, nothing. So we'd pick you up in your home, and if you have difficulty walking, we'll actually come into your apartment and assist you into the van. We have gorgeous vans. And you arrive at the center, and you arrive at the center however you are. Maybe you're glad to be there. Maybe you're in a crummy mood, you haven't been in a crummy mood. So what's remarkable is the staff. So the way the staff just lifts you up emotionally, they are glad to see you. They're like, oh, hello, Mr. John, I'm so glad you're here. We've got your favorite meatloaf and apple pie for lunch. We have our own chefs that actually prepare stuff on site. We're going to be playing bingo and categories today. We're going to get you your physical therapy that you need. The nurse wants to look at your wound and see how that's handled. And you've got this whole team of people that are so loving and caring. It's remarkable. And then you've got the other participants. So this is a place where a lot of people who don't have much or maybe any social life actually get to have interaction with other people.
And I would think that would be key too as you get a little bit older, and I'm sure there's some loneliness there, to get you out of your house, to get you out of the apartment, to interact with some other people has to be huge.
It's very huge. I mean, it's the physical part, so we get you moving. I mean, if you're literally sitting in front of a TV all day, that's degenerative. There's always eyes on you to see, even our drivers are trained in CPR and also to notice if there's any change in your health.
Right.
There's a whole team of people looking out for you, but that's true, that socialization, that psychological component of interacting with someone, I mean, that's what human beings do.
That's what we all need to do.
And that's what we need to do.
Now, you'd also mentioned you have in-home care too, in addition to the health centers.
That's correct. So in home, it's all based on need, right? So if need be, we can do light housekeeping, meal preparation, medication prompting, which can be so critical. We can do bathing if needed, that kind of thing.
So there's literally a solution for every obstacle in somebody's life. So
Yes.
there aren't any excuses anymore of I can't do this or I can't do this, or if you're busy, if you have a senior parent that needs some help, you have the answers with Life Pittsburgh.
Yeah, some of our participants are very, very vibrant, and some of our participants, you can't believe the level of acuity that we're able to maintain them in their homes despite they've got 8, 9, 10 degenerative illnesses, they've got every kind of problem you can imagine, they can barely get around, but they want to be at home, and we're keeping them at home and keeping them safe at home.
And I think that's something that for their mind that has to be a huge relief, that they're not going somewhere they don't want to go. They can live their life in their own home.
Yeah, that, and also a relief that they know that their caregiver, if they have one, has some support. Sometimes your caregiver relationship, you wind up with your kids having a patient-caregiver relationship instead of a mother-father, son-daughter relationship. And with Life Pittsburgh, we can restore that natural parent-child relationship.
Bill, before we wrap up, what's one thing you'd like to leave with everybody watching this morning?
Yeah, thanks. The main thing you really want to worry about is maybe you have a fall, something happens, you wind up in the emergency room, you wind up getting admitted to the hospital, and then maybe you're shipped off to a nursing facility to recover, but maybe you don't quite recover, and maybe you're sort of stuck there, so you kind of limit your options. So there's that. And plus, just pick up the phone and call us. We have really great people manning the phones, and they know about many, many programs in the city. So if we're not the ones to help you, we can find people to help you. But if you need some more support to live at the home, just pick up the phone and call us.
You have the answers.
We have answers, and we want to help you. That's why we're there.
Call them. Life Pittsburgh. It's easy. Pick up the phone and call today. Life Pittsburgh. Call Bill, 412-388-8050, or log on to lifepittsburgh.org. If you'd like to advertise here on our show, call us at 412-575-2400 or email at showcase@kdka.com. Scott Waitlevich from Equitable Gas up next when Showcase Pittsburgh continues.